Here is a detailed explanation about resectoscope, covering all the points you've listed. 1. Introduction. A resectoscope is a specialized surgical instrument primarily used in transurethral surgeries to remove tissue from organs like the prostate or uterus. It plays a crucial role in procedures such as transurethral resection of the prostate, TURP, and transcervical resection of endometrium, TCRE. It combines visual inspection and tissue removal, ensuring precision and safety during minimally invasive surgeries. 2. Definition: a resectoscope is a urological or gynecological endoscopic instrument used for the visual inspection and surgical resection of tissue within body cavities, especially the bladder, prostate, and uterine cavity. It integrates optics, illumination, irrigation, and electrosurgical functionality. 3. Types: resectoscopes can be classified based on A. Field of use: urological resectoscope for TURP, TURBT. Gynecological resectoscope for hysteroscopic procedures, e.g. fibroid or polyp removal. B. Electrical type: monopolar resectoscope uses one electrode and requires non-conductive irrigation. Bipolar resectoscope uses 2 electrodes and allows saline irrigation safer. C. Sheath size varies typically between 22 AR to 28 FAR, French scale. 4. Parts of a resectoscope. A standard resectoscope consists of outer sheath, guides the scope and enables irrigation. Inner sheath channels working instruments and optics. Obturator helps insert the sheath safely. Optical telescope provides visualization. Electrode loop for cutting, resecting tissue. Working element allows movement of the electrode. Irrigation system maintains clear vision. Light source connector for internal illumination. Camera attachment optional for image capture and display. 5 uses: urology, TURP, transurethral resection of prostate, TRBT, transurethral resection of bladder tumor. Gynecology, hysteroscopic myomectomy, polypectomy, endometrial ablation. 6. Precautions: ensure sterile equipment to prevent infections. Monitor irrigation fluid type and volume, especially in monopolar setups. Check for electrical safety and grounding. Avoid prolonged resection to reduce Tuer syndrome risk. Ensure clear visualization during procedure. Confirm patient has no electrolyte imbalance prior to using monopolar systems. Advantages: minimally invasive, no large incisions, faster recovery time, reduced bleeding compared to open surgery, shorter hospital stay, high precision in tissue removal, real-time visualization. 8. Risks and complications: HER syndrome from fluid overload, hyponatremia in monopolar systems, bleeding or infection, urethral stricture or injury, perforation of the bladder or uterus, incomplete resection, thermal injury from improper electrosurgery. 9. How to use: step-by-step procedure. A. Preoperative preparation. 1. Obtain informed consent. 2. Perform necessary investigations, CBC, electrolytes, imaging. 3. Position the patient, lithotomy for urology, dorsal for gynecology. 4. Ensure anesthesia, regional or general. B. Procedure steps. 1. Insert obturator into outer sheath for safe insertion. 2. Introduce into urethra or cervix, under lubrication and guidance. 3. Remove obturator and insert inner sheath with telescope. 4. Connect irrigation fluid, start continuous flow for visibility. 5. Insert working element with electrode loop. 6. Start visual inspection, use camera light system. 7. Perform resection, move the electrode back and forth to remove tissue. 8. Control bleeding, use coagulation setting as needed. Evacuate chips, use irrigation or resectoscope evacuation system. 10. Withdraw instrument carefully. 11. Postoperative care, monitor for bleeding, infection, fluid imbalance. 10. Conclusion: the resectoscope is a cornerstone instrument in monoscopic urology and gynecology, enabling safe and effective tissue resection with minimal trauma. While it offers numerous advantages in terms of recovery and outcomes, proper technique, device handling, and patient monitoring are crucial to avoid complications. With ongoing technological advancements, bipolar and advanced optical systems continue to improve its efficacy and safety. Thank you. Have a nice day.